A research team in Germany recently performed autopsies on 27 patients who died of coronavirus. They found the infection not only in the lungs, but also in the heart, liver, brain, kidney, intestines.
As always on Thursday mornings, we are joined by Dr. Dana Hawkinson from KU Health this morning, live to answer some questions for us. Doctor, as always, glad to have you. The virus has been classified as a respiratory virus. We know that. But do we know more about how it's able to infect these other parts of the body?
Yeah, absolutely. We know that the receptor, or the proposed receptor, the most likely receptor for the virus, and that's the way that the viruses or any virus can get into our body and our cells, is the ACE2 receptor. It's just a protein on our cells. We know that those receptors are in other parts of our body. We know, of course, it's in the lung or the respiratory tract. We know those receptors are in the heart, in the kidney, in the GI tract, or in the intestines. So we know that those receptors are everywhere else on the body. It's just a matter of how much are they expressed. But we know that, but they're present. So that's absolutely the reason that the virus can infect those other organs of our body.
Doctor, something we've been hearing a lot about this week, this inflammatory syndrome that we are now seeing in some kids. We know necessarily right now it's considered kind of rare, but we're seeing this increasing number, and now we know there is a case at Children's Mercy. Can you just talk about, does this mean we should be very afraid out in public now, even more reason to keep our kids inside, and what kind of things should we be looking for in our own children?
Yeah, I mean, I wouldn't say afraid, but certainly cautious. You know, since day one that we started learning about this, and from the Chinese experience and what they reported, we were really pretty happy and optimistic because it seemed to spare the children. So certainly we knew that children could get ill. They could go to the hospital, be very sick, and even die, but it was in significantly lower proportions than, say, the older adults, and especially those with other comorbidities. So now that we are seeing this, you know, there are still relatively few cases compared to all of the cases, but it's still concerning because, again, just with any of these other side effects that we're seeing in adults with the blood clotting and things of that nature, you really never know who is the child that's going to be at most at risk for this. Those are questions that we don't know. But I think it's certainly something to be concerned about. It's not just as if, hey, we're going to have a COVID party and go get our children infected so that they have immunity. You know, that's not the smart way to go about it. But we know now that they can have this inflammatory syndrome. And again, while it's a relatively or very small proportion, you know, every child is a case, and it could be your child or somebody you know. And it's very concerning for sure.
Doctor, these symptoms for that inflammatory disease, when I was looking at them going, man, those seem like they could easily be considered something else that's minor. What's the line here? What are the symptoms, and when is it enough to say maybe we need to go see the doctor?
Yeah, as far as the acute infection, you know, a lot of these inflammatory symptoms unfortunately happen 2 to 3 weeks from having the infection. So people recover, and then they develop these, you know, especially for adults, they can develop these blood clots. For the children, they can develop the this inflammatory process. It's really difficult to say. Certainly, if you have the blood clots, particularly in your lungs or your legs, you know, you may lose feeling or sensation. You may find it hard to breathe if the blood clots are in your lungs. For a child, it's a little bit more difficult. I think you have to continue just to watch and see how they do. You know your child. They always can't articulate how they're doing and how they're feeling. So it's just really important to monitor them, especially if you've known they've had COVID-19, say, in the past 2 to 3 weeks.
All right, Dr. Hawkinson, as always, thank you so much for joining us. We'll talk to you again coming up at about 6:45 with more questions. Thank you.